Doc, earlier you sounded the warning dun sa possible waning ng efficacy ng vaccines. Let me back it up a bit. What do we know and what should we know about how long yung efficacy ng mga bakunang ito? Kasi iba-ibang brand, baka iba-iba ang efficacy at iba-iba yung length ng efficacy.
Yeah, you're right, Ed. No, and when we start counting those maybe vulnerable at this point in time, are those who were vaccinated beginning March and April, and these are the healthcare workers. And on the ground, we do experience some of these healthcare workers having mild, moderate COVID since August and September. And we don't want that to happen, that to the point that we'll be seeing healthcare workers having severe infection, especially with the longer wait for the booster dose. 7 to 8 months after will be like November or December. So I hope this will be one of the priority of the government to give the booster to the healthcare workers.
Pero sir, parang ang hirap ng pagbabalanse ba? Dahil on one hand, kailangan mong bakunahan yung wala pang turok, hindi pa natuturukan ni isang beses. On the other hand, kailangan mong habulin yung mga nag-gawin na yung bakuna.
Yeah, correct. No? Pero at this point in time, there are already surplus of the vaccine supplies. And I think that ilan lang ba ang mga healthcare workers, no? And these are the frontliners who are really taking care of COVID. Allotment of vaccine should also be prioritized for these healthcare workers, because as we move forward and we'll have some of these mini surge of cases, November, December, hopefully it will not happen, then we're always at risk for these exposures.
Yeah, Dr. Solante, gaya ng sinabi nyo, may surplus. A lot of people have been saying that certainly by the end of the year, they're anticipating that supply will not be a problem. But when you talk of a surplus and stability in supply, that does not have any concern or any dilemmas when it comes to matching of vaccines. I mean, we have a surplus regardless of kung anong bakuna na nakuha mo at saka pwede mong gamitin for a third dose.
Thanks for that question, Robbie. There are already good data to indicate that whether this is a Sinovac as a third dose to those who are fully vaccinated with Sinovac, or an mRNA vaccine, or even a virus vector vaccine like Astra, this can be interchangeable in terms of protecting or eliciting protection. Okay. So that means that if we have limited supply, then we can accommodate and we can prioritize some of those supplies that are volume or high in volume, and more or less we can make it happen in terms of giving this to the health workers.
I was going to ask, if the data that you're getting and that you have access to, can you monitor that phenomenon, or at least that theory that baka mag-wane na? And because people are starting to count, di ba? Everybody's bringing out their vaccination cards. Teka, kailan nga ba yung huli kong...
Remember, 8 months na since the first vaccination in March 1.
Oh, di ba?
And these are healthcare workers who are
those
more
are the
exposed
frontliners
to
in
COVID-19.
particular, di ba? But are you able to monitor that people who do you have good enough data where you can disaggregate this rolling concern for people as they hit the 6-month mark and so on?
At this time, we don't have the data. We'll try to get it sa mga hospitals siguro, kasi mostly mga frontliners yung mga naunang nabakunahan, and then yung mga seniors. It's possible na baka nagwe-wane na and hindi natin alam, because we're seeing good numbers right now, bumababa yung cases. Kaya hindi pa natin natetest talaga yung theory na yan. This is still theoretical. So makikita talaga natin yun when the numbers coincide with what we are expecting. So, pero minsan maganda rin, unahan na natin. Hindi na natin kailangang hintayin na mag-wane siya in theory. Pwedeng, yun nga, bigay na natin yung booster sa mga seniors at sa mga frontliners.
Pero Prof. Guido, like I told you the other program, di ba? Parang naghahabulan tayo eh. On one hand, hinahabol natin na mabakunahan yung mga hindi pa natuturukan ni isang beses. On the other hand, kailangan natin habulin yung mga maaring nag-wane na yung kanilang bakuna na binigay nung March, April. So parang on two fronts kailangan mo maghabol.
Yeah. And this is the challenge, actually. The challenge here is how to deploy, optimize the deployment outside of the National Capital Region. And the big challenge now is, in the National Capital Region, we're more or less set. Most adults are actually vaccinated. So we won't have the kinds of surges we had early part of this year. We'll probably have some upticks. And mostly in those parts of the population, in the National Capital Region, they're unvaccinated children, maybe some of the elderly. But early part of next year, we're also projecting, before the elections, there might also be a surge. That's why we have been talking with our friends in government and the private sector. Maybe the strategic stockpile that we have should be now, slowly given out as boosters, especially to our frontliners, our elderly, and later on those who have comorbidities. Like, for example, I had my last vaccination was in May. So if this theory is true, then I might have waning, efficacy maybe early part of next year. But I also contracted COVID. So there are people who have natural immunity plus vaccination. That's a different story. So we're not seeing so much of a problem in the National Capital Region, in the NCR Plus, in Cebu, Metro Cebu, and Davao. But we're seeing this challenge more in places outside of those areas that were prioritized for vaccination. And that's why the key now is to roll out the vaccination more efficiently and continue with testing, tracing, and isolation in areas where optics evolve.